Hello, my name is Marla. I'm a level 1 student. Do you mind giving me a report on your patient?
Sure. I'm taking care of Shanana O'Connor. She's in room 231. She's a 34-year-old female who is allergic to sulfa. She came in with a primary diagnosis of a fever and a secondary diagnosis of end-stage renal disease. She's on a renal diet with a 1500 fluid restriction. With her diabetes, type 1, she came in with fever and chills and just general malaise. She reports that she's had elevated blood glucose readings and decreased appetite for the past few days with minimal urine output, and she says that it has been more concentrated. She is on dialysis. She does that 3 times a week, and she's been on it for a year. She is on the transplant waiting list. She was diagnosed with type 1 diabetes at age 8. She does have retinopathy and neuropathy, and she has a history of recurrent UTI. She has a right forearm IV. Her skin is intact with no issues. She does have no vision problems, but does wear glasses. She doesn't complain of any chest pain or shortness of breath. And she does have a weight gain of 10 pounds over the past few weeks. Her bowel sounds are active in all 4 quadrants. Her pulses are 2+ on her upper extremities, and in her lower extremities they're 1+. And she does complain of some edema in her lower legs. And her capillary refill is greater than 3 seconds. Her UA was positive for white blood cells. Her CMT and CBC are pending. Because of the white blood cells and the UA, we are going to be giving her an antibiotic IV. It's going to be impenem, 500 milligrams, over 1 hour in 100 milliliters. And she also will have sodium chloride, 0.9. That'll be running at 30 mLs an hour.
Why specifically is this client receiving this medication?
The client has a fever and elevated white blood cells in her urine, which indicates possible signs of infection.
What action does the medication have on the body?
It binds to the bacteria cell wall, causing cell death.
When should you question administering this medication?
You should question it if they have ever had a prior any allergic response, or when the client is receiving penicillins or cephalosporins.
Does the medication have a therapeutic serum level?
No, it does not.
Which vital signs must be monitored?
All vital signs are important, but specifically right now it should be her temperature, because her last temperature was 100.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Fluid retention, white blood cells, rash, wheezing, and anaphylaxis.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and home?
To report any signs of a superinfection, like possible like diarrhea, loose, smelly stools, any overgrowth of tongue, vaginal itching or discharge.
And what are the side effects and potential adverse reactions?
Side effects are seizures, hypotension, nausea, vomiting, diarrhea, rash, and phlebitis at the IV site, and adverse effects would be anaphylaxis.
And how will you know this medication is effective?
The white blood cells will decrease and the fever will go away.
Oh.
So I'm going to be going into my patient's room. So I would go ahead and do my hand hygiene. Hi, my name is Toni. I'm going to be your nurse today. Can you go ahead and tell me your name and your date of birth?
Shanana O'Connor, 34 years old.
And do you have any allergies?
Sulfa.
Okay. And I'm just going to go ahead and check with the computer. And that is correct.
Monitor, make sure you got the dosage correctly. For the patient. Report any unsafe. Oh yeah, report things, like if you see the nurse not wearing gloves, that too. No, it's not. Side effects. To have the right to refuse, to report any unwanted side effects to the doctor or the nurse, or report any diarrhea or referring to, or don't suspect, you know, I would say like diagnosed stools.
That's one of like the things.
Yeah. Or
Okay, so the doctor has ordered an antibiotic to be given through your IV. It's going to be run over 1 hour, and then we also have just normal saline fluids that are going to be running at 30 mLs an hour. So I'm going to go ahead and prepare that antibiotic. Do you have any questions for me?
No, I do not.
Okay. So I'm going to go ahead and leave the room, do my hand hygiene, and go ahead and prepare the medications. So I am going to check my normal saline against the MAR. Make sure I have the right patient, which is Shanana O'Connor, the right time, the right dose, the right medication, and it's going to be the right route. And we have, it starts at 6:30. It's going to be 30 mLs an hour. It's going to be continuous. And so we're good with that one. I'm going to go ahead and check the expiration date and the clarity. There's it's not expired and it's clear, so we're okay. And then with the antibiotic, the Impenem, I'm going to go ahead and check the right time, the right dose, the right medication, the right route, and the right patient. So it's going to be 500 milligrams and 100 milligrams to be ran over 1 8-hour. It's going to be through the IV, and it'll start at 6:30, so we're okay with that one. I would also check the expiration date on this one to make sure it wasn't expired and that the medication was clear, and it is. So I'm going to go ahead and put on gloves. I'm going to bring the medication pole into the patient's room. I'm going to check the patient's name and date of birth. Can you tell me your name and your date of birth one more time?
Shauna O'Connor, 34 years old.
And any allergies?
Sulfa.
Okay, perfect. And then while I'm preparing the medication, again, I'm just going to go ahead and check it to my MAR. Make sure I have the right patient, the right dose, the right time, the right medication, and the right route, which is through IV, so everything checks out. And as well with the antibiotic, check it to the MAR, make sure I have the right medication, the right route, the right dosage, the right time. So So since this is going to be piggyback, I'm going to go ahead and just put this one like this, so it'll be hanging lower than the antibiotic. I'm going to go ahead and put on my gloves.
When should you question administering this medication?
So you're going to question giving this medication if the patient has an allergy to penicillin.
And then I'm going to go ahead and spike my medication and make sure that my
Which vital signs must be monitored?
it's clamped.
This drug doesn't have a therapeutic serum level, and you're going to want to monitor her vital signs, so her pulse, to see if she's still tachycardic, her temperature, if the fever gets down. You're going to want to monitor her labs, white blood cells.
And when I open this, I want to make sure that it stays sterile and this doesn't touch anything.
And I kind of answered my next question of which physiological parameters should be monitored.
So yeah, her temperature, her urine, her white blood cell count.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You're going to want to teach the patient to look out for any signs of anaphylaxis, so any rashing, itching, angioedema, so swelling of the tongue. Also, you're going to want to ask
So to go ahead and prime this one,
diarrhea, because this medication can
I'm going to unclamp it.
So you're going to want to ask her to look out for that. And you're going to want to also look out for any other signs of infection that the patient has as well. And
safely at home.
This medication is mostly an injection. They're not really going to be getting that at home. But if they did, we wanted to,
Okay,
sometimes keep
sorry,
the
it was
medication
tangled.
fully until it's out so that they don't have a chance of getting it, or the infection again, or, excuse me, developing sensitive.
So I'm gonna go ahead
They
and unclamp
get
this.
sensitized to the medication so that we don't have an effect
Squeeze
next
a
time.
little bit into the chamber. And then I'll
What
go
are the
ahead and
side effects
unclamp
potential adverse
to
reactions?
make sure I don't have any.
Side effects they're gonna have would
Bubbles.
be, they could be at risk for seizures, and as I mentioned before, they also can get C. diff, so you're gonna wanna monitor their diarrhea. They would have, you would wanna keep an eye out for the, if it has pus and mucus in the stool, and also they can get, nausea and vomiting.
Okay, then I'll go ahead and clamp that back.
How will you know the medication is effective?
Well, no, it's effective if the fever comes down and if her,
Next,
labs
I'm going to go
come back.
ahead.
No further questions.
Okay, so we're just gonna go in the room, I'm gonna pull the med here, I have it already.
I'll put my diaphragm on now.
Just gonna go into the doctor's orders. And the doctor ordered, she ordered independent, Prolastin, which the other name for is Pharm.
And then I'll make sure that this is on to,
and look at that, and
to
confirm with
prime.
the mark, and also now look at, or excuse me, confirm with the
To,
doctor.
it'll be on to prime. And then I'll unclamp it again, just so that this is primed as well.
So she has independent Prolastin, 500 milligrams over.
And if there's no
100,
bubbles.
milliliters in an hour. And I'm checking the expiration date and it's good to go. I'm checking the clarity as well. And she has a 0.9%
Next,
normal
I'm going
saline,
to
which is on the mark here. And that's.
prime my
the expiration
antibiotic.
date is good and the clarity of the medication is good.
Or I'm gonna spike my antibiotic. And again, when
Pharm
inserting this, I wanna make sure it's sterile and make sure that this doesn't touch anything.
things. I'm gonna check my drug test.
And make sure that when you do, spike it, that it's clamped so it doesn't start flowing.
Okay.
And then I can hang this one higher above. And then I'll go ahead and get an alcohol swab.
I'm Melody.
And
I'll
I'm
be
going
your
to
student, or I'll be your nurse today.
attach it to
I
the
have a
pulmonary
nurse
infusion.
with me as well, student Maria. So can you tell me your name and date of birth, please?
Shanana O'Connor, 34.
And do you have any allergies?
Yes, I do. And then when attaching this, you want to make sure it doesn't touch
Yeah, it's
anything
hard to say.
besides
The
where
trimester
it's going.
is so fun.
Yes.
Okay. So
Slip
we
it
will
on
be
there.
giving you that then. So I have your meds here. Have you ever gotten?
And then to prime this one,
Drug you have,
I'm
it's
gonna
called
go ahead and bring it below the primary infusion. I'm gonna unclamp it
The doctor ordered this for you because
and
it
just
does
make
say
sure
that
it's,
you
see
have
it's
the
primed
fluid
because there's
infection.
fluid in there.
He doesn't know, we don't know exactly what it is.
So I'll go ahead and
It's
clamp that
enough
back.
to give you that theory that you
Hang
have.
it back up.
Do you know, you don't know any side effects or anything?
No.
Alright, so with this one,
Okay,
you're gonna
so
wanna,
now,
pay attention to your
I
side
can go
effects.
back
So
into
you're
my
gonna
patient's
have,
room.
possibly
I'm
diarrhea,
gonna go
nausea,
ahead and
specifically with the diarrhea, you could
Um,
get, C. diff.
go ahead and get the green light. Again, can you go ahead and tell me your name and your date of birth?
Shanana O'Connor, 34 years old.
And I see your only allergy is to sulfa, is that correct?
Yes.
Okay.
Therapy, you can also develop C. diff in a few weeks after.
So
if
for
you
my-
see those symptoms when you go home, you wanna come back, okay? Alright, just gonna get this set up for you. I'm gonna scan. I'm gonna try the primary. So it's the normal saline, 0.9% normal saline for, and then no, or well, she has an allergy to trimethoprim sulfamethoxazole, and we're giving it at, it's due at 8 o'clock, but we're going to do it at 7:38 right now. This actually can be
Nope.
Okay, Shanana O'Connor, we have the right patient, and I'm doing the normal saline, 0.9% normal saline.
Okay, so I have the green light. So I'm just gonna go ahead and put it's gonna be into her right forearm IV.
When it's going in your right forearm, before I give the med, I'm just gonna check to make sure that your IV is good.
And if I had any questions throughout all this about the medications or the dosages, I could go ahead and call the pharmacy or check with my drug book. So I got the green light for the normal saline, and then I'll go ahead and do it for my antibiotic.
Just gonna rub this in for a second. Alright, and you're just gonna let me know if you're feeling any pain or if it gets hot or anything like that, okay? First I have to unclamp it. Alright. You feeling okay? Yep.
Okay, so I also have the green light for that one. So I'm gonna go ahead, it's gonna be in the right.
Your normal saline. And again, just to confirm, we have 0.9% normal saline.
Right
for
forearm.
chronic surgical erythema without allergy to trimethoprim sulfa.
Administer time will be. Okay. Okay, perfect. So now that I have the green light for both of those, I'm just gonna check one last time, before I actually administer the medication.
Alright,
Um,
so for this,
Shanana, can you go ahead and tell me your name and your date of birth?
Shanana O'Connor, 34 years old.
And any allergies?
Just the sulfa.
Okay. Before I go ahead and administer this for your IV, I'm gonna go ahead and flush your IV. Can you just let me know if you feel any pain or discomfort?
Okay.
For the teaching left, can you tell me the there we go. Got it. And everything's still, we haven't hit you. Tell me again.
Are you feeling any pain or discomfort?
Nope.
Okay. Then, I'm gonna go ahead and attach
chamber, about 2/3 of the way.
the medication. And I'm just gonna make sure that that is set at 100 mLs an hour.
Loosen the top a little bit.
Okay, so now that we have that set at 100 mLs an hour, I'm just gonna go ahead and unclamp it so that it begins to run. And I'm gonna check for my 5 drops.
Okay, so that is primed, our line's primed, and then you're gonna look out for any bubbles or anything. Small ones. Oh, so our bag is good.
Okay.
Our line
Okay, so with this medication, we just want to monitor for any signs of lightheadedness, dizziness, blurred vision, or if you're feeling any warmth or any inflammation around your IV site. Do you think you can let me know a couple signs or anything to look out for and let me know? Call us if you're feeling that.
Sure. If I feel any burning at the site or if I have any dizziness.
Okay, good. So, this is going to be running for an hour. So, in an hour, I'm going to come back and I'm going to disconnect you from your antibiotic, and then the normal saline that will just continue running. Okay? Do you have any questions for me?
No.
Okay, before I leave, I'm just going to make sure your bed is all the way back down. And I'm just going to make sure that you have your call light in reach, which is good. You do. Okay, anything else I can do for you?
No. Thank you.
Okay, thank you. So I'm just going to go ahead and perform my hand hygiene. And I make sure I charted everything. Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I reviewed the urinalysis, which showed white blood cells, which showed that there was indication of infection.
Did this information affect your decision to administer the medication?
Yes, the medication's an antibiotic, and since her urine showed white blood cells for infection, we decided to go ahead and give the antibiotic.
Okay. Did this information affect how you administered the medication?
No.
Okay, thank you.